More is Dr. Jason Kerr, geriatrician at Trillium Health Partners. Thank you for joining us.
Thanks for having me, Lauren.
So can you break down for us some of the health effects that come from time change? Are there any serious concerns that come from changing the clocks twice a year?
Yeah, so we all have a circadian rhythm, which really means an internal body clock. Our body knows when it's time to wake up and when it's time to go to sleep. The issue with the clock change is that rhythm gets disrupted. So certainly many of us today had to wake up an hour earlier than normal, and we probably feel a little groggy, a little drowsy. In terms of my area of expertise, I'm a specialist in older adults, and the concern that we have whenever the clocks go back or go forward is it can precipitate something called delirium. That's a sudden change in thinking for older adults that can have very negative consequences. We see a lot of it in the hospital, but also even older adults at home who may have some underlying cognitive impairment like dementia. They really do struggle with that clock change, and it can actually precipitate more confusion.
What should Canadians be mindful of in order to avoid some of these symptoms?
So I think just being aware that it's happening. If you can, try to, the first few days of the clock change, maybe not have as much of an abrupt change to your schedule. Certainly, one of the main issues with daylight savings time is the lack of morning light. And again, in our older adult population, especially in the hospital, that lack of morning light can really be disruptive as it sets the tone for your body for the rest of the day. So even things like light therapy or using a light box in the morning when it's still dark out can be very helpful.
So British Columbia is saying this is the last time they will be changing their clocks. Will we see a difference in health in Canadians living in BC compared to other parts of Canada? Is this something we have been seeing in parts of Canada that do not observe daylight savings at this point?
So I'm not an expert in the clock change, but I have been reading about the change in BC, and I think there's very valid concerns. It's not just related to the circadian rhythm that I talked about, but in addition, having more darkness in the morning for the entire year does lead to a higher risk of things like accidents and pedestrians getting into car accidents as well. So certainly that's something that province and people there will have to be very conscious of going forward.
Interesting. Some really, really important points to keep in mind. Thank you so much for joining us, Doctor.
Thank you.
That's Dr. Jason Kerr, geriatrician at Trillium Health Partners.